If you're a man older than 40 years, you might be at risk for certain conditions related to the prostate gland. We spoke with Dr. Nguyen of Pomona Valley Hospital Medical Center about problems that may develop in the prostate.
Well, the prostate gland is an organ that sits between the bladder and the urethra. So the bladder empties through the middle of the prostate gland, through the urethra to the outside. As men get older, the prostate gland does two things that may be problematic. The first condition is benign growth of the prostate gland, where the prostate itself gets enlarged. The second problem is prostate cancer, and those two problems can exist together or they can exist independently of each other. It usually occurs in men past the age of 50s, but sometimes can occur in men in their 40s as well. The two biggest risks are African American men and men with family history.
Dr. Nguyen also discusses benign prostate problems.
You can have a benign enlargement of the prostate gland and have no prostate cancer, and vice versa. You can have prostate cancer and have no benign enlargement of the prostate gland. Basically, the prostate is like a donut. If the hole in the middle is what matters to me. And obviously, there are more people with big prostate gland or with small opening than vice versa. But that, again, doesn't always exist. You can have a big prostate gland and have no problems, and vice versa. You can have a small prostate gland and do have problem because the channel, the hole in the middle, is problematic. The prostate cancer grows in the middle of the prostate gland where it blocks the channel where urine cannot come through. Urinary retention can occur. It can block the ureters, the tube that drains the kidneys, so a person can go into renal failure. I think back in the 80s we were underdiagnosing and undertreating people, and a lot of patients came into our office with those late symptoms. Nowadays I think most Americans are diagnosed before those symptoms occur.
Dr. Nguyen talked about the screening for prostate problems.
The PSA can only give us probability of when prostate cancer may be seen if an invasive procedure is found. For example, a blood test with the PSA between 4 and 10, the risk of having prostate cancer is 25%. So if the blood test is between 10 and 20, that risk is 50%. So the higher the number, the more likely we are as physicians to find prostate cancer if we perform an invasive prostate biopsy. And definitely the biopsy is invasive, but it takes 5 to 10 minutes. The risk of infection or bleeding is less than 1%. I think a combination of PSA blood test and prostate digital exam is very important. For example, if I see someone with a prostate exam that's abnormal, when I put my finger into the prostate gland and feel it and it's hard and nodular, PSA can be very low. As a matter of fact, one of my patients, his PSA was 1, and yet he has a very aggressive early prostate cancer that we found with a finger exam. Vice versa, I've seen people with the PSA in the 50s and 60s that have no prostate cancer. It's a different scenario than someone with PSA that went from 4 to 8 within 6 months with an abnormal digital exam that is performed now versus 6 months ago. I think different scenarios call for different answers. 90% of men who are treated for prostate cancer beat prostate cancer who are still alive from prostate cancer as long as they get treated. Definitely for my early training when I came out of my residency in 2000, 12 years ago, and compared to what we started doing 6 years ago, the successful rate of treating people for prostate cancer with surgery is remarkably different, and it's something I'm proud that we're able to offer to our patients in this community.
And that's this edition of the American Health Journal. If you have any questions about the topics or doctors that appeared on our show today, you can contact us at 1-800-303-3200. Or now, you can explore our new website, AmericanHealthJournal.com. All of our interviews with doctors with a wealth of health information can be seen there. That's AmericanHealthJournal.com. I'm Roger Cooper. Thanks for joining us.